mynews.studio.
Picture this, a mobile clinic arriving at dawn in a remote Bolivian village. Global childhood vaccination rates are finally ticking upward again. But why now?
Today's date is 2025-07-21. We've just received new data showing global childhood vaccination rates are climbing after several years of decline, mainly due to COVID-19. The numbers are moving in the right direction, but what's changed? Why is this happening now, and where are we seeing the biggest improvements?
The Americas are especially notable. Last year, coverage for key vaccines like MMR, pneumococcal conjugate, and hepatitis B at birth all went up. For instance, first-dose MMR coverage rose from 86% to 88%. Hepatitis B at birth increased from 64% to 68%. And HPV vaccination for girls under 15 reached 76%, which is actually the highest worldwide. But what's responsible for these gains?
It looks like it's a combination of factors: renewed government commitments, targeted outreach, and a real push to reach marginalized groups. Still, more than 1.4 million children in the Americas had 0 vaccine doses last year, and some areas actually saw a drop in DTP1 coverage. Does that mean this progress is on shaky ground, or is something else missing?
These gaps show that outreach efforts, while effective, aren't reaching everyone. Some communities are still left behind. That's where local leaders and healthcare workers come in. Their efforts are crucial for rebuilding trust, especially—
Hold on. When you say rebuilding trust, do you mean specifically combating vaccine hesitancy, or is it about something broader?
both, actually. In places with vaccine hesitancy or a lot of misinformation, local leaders are the ones who can speak to people in their own language, address myths directly, and organize campaigns that feel truly accessible. Their involvement goes beyond just sharing facts. It's about making vaccination relatable. The World Health Organization points out that without these grassroots efforts, even the best top-down policies can fall short.
Innovation is another angle. During the pandemic, health systems started using mobile clinics, digital record-keeping, and bringing vaccines straight to people. Do you think these changes are here to stay?
They have potential, but it's not guaranteed. Keeping mobile clinics and digital systems running means steady funding and making them part of regular healthcare. There are big hurdles: supply chain issues, training enough staff, and operating in places facing conflict or instability. If funding dries up or political will fades, progress could stall.
And looking at the numbers, global rates are still hovering at a plateau. The issue of zero-dose children hasn't been solved. So is this rebound a real turning point or just a brief recovery?
That's what everyone's watching. Childhood vaccination is fundamental. Without it, child deaths rise and outbreaks become more likely. The recent progress matters, but keeping it going means ongoing collaboration, investment, and strong local involvement. The big question is whether global health systems can sustain this momentum.
We'll keep an eye on these numbers because the implications go beyond any single country. They affect public health everywhere.
So to sum up, global childhood vaccination rates are rising, driven by outreach, innovation, and local leadership. But the challenges are far from over.
Thanks for joining us as we unpacked what's behind the rebound in childhood vaccinations and what it means globally.
Thank you for listening. This episode was powered by mynews.studio. Try it now for free.